Southern Tier HealthLink is one of 10 RIOs that span the state of New York. Our office is located in the historic Old Lackawanna train station in downtown Binghamton. As with any healthcare organization, our work at Southern Tier HealthLink often uses numerous acronyms, which can easily get confusing. Let's explain a few of the basics. EHR or EMR refers to electronic healthcare records or electronic medical records. These are computerized medical records housed in a record-keeping system at healthcare facilities such as a hospital or your doctor's office. HIE stands for Health Information Exchange. HIE describes a system of sharing or exchanging these electronic medical records between providers and separate organizations so that doctors who do not use the same EMR system can access records on patients they share. RHIO, pronounced RIO, is a regional health information organization. RIOs are not-for-profit organizations that manage HIE systems to make sure that the exchange of information between providers is working properly and is secure. PHR means personal health record. PHRs are similar to EHRs, but are managed by the patient rather than the physician. They are a collection of medical information about a patient and are able to be viewed by using secure sites on the internet. STHL, or STHL, is short for Southern Tier HealthLink. STHL is your local RIO and manages this community's HIE. So how do these acronyms all fit together? STHL is the local RIO that oversees the HIE in this community, which stores information from multiple EHRs. Connected providers can access this information through STHL in multiple ways, as long as their patients have given them the consent to do so. Southern Tier HealthLink is connecting the dots in our community. We are a successful, developed, and robust RIO, including 5 New York State counties, which is a span of over 4,600 square miles. There are over 400,000 people in our region, and 45% of those have provided a consent choice of either permit or deny for STHL. Of those who have given consent, 90% have said yes to letting their providers have access to their records through the STHL Health Information Exchange. The Health Information Exchange works as a cyclical process. Patient records are housed in the STHL HIE database. Queries for this patient data happen electronically. When there is a match on a query for a patient's data, the system sends the patient's information to the requesting source electronically through an outbound transaction. These queries and outbound transactions occur between STHL and our connected data users, who practice at multiple connected organizations throughout the community. Once the patient is seen by their connected provider, the information from their visit is then electronically sent back to STHL through an inbound transaction. This updated patient data then becomes part of that patient's record in the STHL database. Due to these inbound transactions, the STHL database is constantly growing in size and becoming a more and more comprehensive source of medical information on patients. There are more than 60 million records in the STHL HIE, and an average of 1.8 million more are added each month. STHL's HIE is home to patient health data in many forms. Providers who are connected with STHL can gain access to health information including diagnoses, lab results, procedures, medication lists and dosages, radiology and other imaging, encounter data, allergies, transcribed reports, vitals readings, immunization records, demographics, physician information, insurance information, and more. Providers who participate with the STHL HIE can connect with us in 3 different ways. First, connected providers can utilize the secure clinical web portal online to log in and look up their patients' data. The STHL web portal means that providers who still use paper records or would have to rely on fax data transferred from other sites can quickly and easily access patient information online. Another benefit of using the STHL web portal is the built-in community PACS viewer. With this valuable tool, physicians can view diagnostic quality imaging studies within the HIE and even collaborate on images with other physicians in real time, all with just a click, no extra sign-ons, and no separate downloads. A second option for providers to connect with STHL is through their own electronic medical record system. By setting up a connected EMR, providers not only can access patient data from the HIE directly within their own medical record system, but are able to send their electronic patient data to the HIE as well. Connected EMRs, such as Medent, receive patient data from the HIE through incoming CCDs, or Continuity of Care documents. The third way a connected provider can interact with STHL is by using the iCare mobile app. iCare was developed by Southern Tier HealthLink board member Dr. Rahman in 2011. It is a secure mobile app for iPhone and iPad that allows immediate bedside access to information for patients who have given consent. Providers at UHS hospitals can use the iCare app, including physicians in the emergency department. Southern Tier HealthLink works hard to connect the dots in your community. The STHL HIE houses patient data supplied by many area organizations, including UHS Hospitals and UHS Medical Group, Lourdes Hospital, including limited information from Lourdes walk-ins, 2 United Methodist Homes facilities, and at this time, 7 different healthcare practices using the Medent EMR system. For a full listing of data providers and users, make sure to visit STHL's website. Southern Tier HealthLink is also connecting the dots in the practice. Our users have found great value in using Health Information Exchange to enhance their patients' care. So what are you waiting for? Connect with STHL today. Give us a call, send us an email, or visit us on the web at www.sthlny.com.